The diversion program is a confidential, voluntary alternative to formal disciplinary action for nurses who may have substance abuse disorders because of the habitual or regular use of drugs and/or alcohol. It is estimated that 14% of all licensed nurses have a substance abuse disorder with alcohol and/or other mind-altering drugs. In 1987, the state legislature enacted Section 61-3-29.1 of the Nursing Practice Act, which authorized the Board of Nursing to establish a diversion program for nurses with substance abuse disorders. A nurse who habitually or regularly uses alcohol and/or other mind-altering drugs presents a potential danger to his or her patients because the use of chemicals can impair the nurse's ability to safely practice nursing. The objectives of the diversion program are to protect the health and safety of New Mexico citizens, to identify nurses with substance abuse disorders or nurses at risk for developing substance abuse disorders before the disease progresses to the point where valuable nurses are unable to practice nursing because of the use of drugs and/or alcohol. To assist the nurse to get the appropriate help he or she needs to stop using drugs and alcohol. To keep the recovering nurses productive by helping him or her to remain in practice or return to practice as soon as possible. To monitor the nurse's practice and recovery for whatever period of time is necessary to assure that the nurse is a safe practitioner. To educate the public and the nursing profession about substance abuse disorders. To reduce the problem of substance abuse disorders in the nursing profession. The diversion program provides ongoing monitoring of nurses with substance abuse disorders. This monitoring can begin when the chemical abuse is identified, proceed through the nurse's treatment process, and then continue through the recovery period for as long as necessary. Nurses are admitted to the program through one of three methods. A nurse may request admission following the filing of a complaint with the board. A nurse may report his or her own problem with drugs or alcohol and request admission into the program. Or, a nurse may request admission into the program in lieu of formal board action against their license, or as a condition for reinstatement of their license following a suspension or revocation. Any RN or LPN who is licensed or has applied for licensure in the state of New Mexico who habitually uses or is addicted to alcohol and/or other mind-altering drugs who requests admission into the program is eligible to participate. For additional information, please contact Rachel Wright, the Diversion Program Coordinator, or the Executive Director for the New Mexico Board of Nursing.